This video is all about getting the hips to work a little bit better. So this video came about because I've got a client who's getting recurring knee pain. Whenever we do any soft tissue work on the guy, it pretty much frees it up and it goes away. So there's no structural damage as such in the knee, it's just that his knee is working way too hard because his hips are so tight they just don't do anything. If you do some more sort of orthopedic tests with his hips, you can see that he's got a range of motion available. It's a bit tight, but there's motion there. But as soon as you get him up and moving around and trying to use his body to decelerate himself when he's moving or trying to squat or whatever, he just tends to just shut down the hips and not use any of the motion that he's got available. So I'm going to try and slightly increase the range of motion he's got at his hips and try and strengthen up the stuff that needs strengthening. To try and offload the knee a little bit in the off season, so when he comes back for pre-season strength training for rugby, he's hopefully going to be in a much better position than he is now, and we won't have to manage this during the season. So a lot of this stuff comes from the Gray Institute, from Z Health, and from a chap in Denmark, I forget his name, where it comes from exactly. Eden Norgard in London, the chiropractor, Danish chiropractor is where I got the info from, and it's a bit of a mix mash of stuff, so I kind of tend to use bits from each area and apply it client specific as when I need whatever it is, and this is just a combination of things that I've come up with as a routine that I find generally helps hips. So you're going to start with half kneeling with the back foot raised. Back foot raised gives you a bit more stretch on here, so you can tweak the height of this if it's too intense, depending on how tight they are. And what we're going to do is we're just going to drive forward and back, keep your body nice and upright. Okay, reach overhead just to get the hip flexor going with it as well. Okay, you really want to work on the timing of your reach and your lunge to happen together. Overhead. You're going to go for about 15 to 20 of each movement. Okay, you'll do that on both legs. And you're going to get up into a bit of an adductor stretch, and then you're going to drive from your hips forward and back. Again, if this height is too high, you just lower it. Okay, 15 to 20 of those. Add a bit of rotation into it. Make sure that most of your motion when you're coming through is happening at your hip. You're not hinging at your back. Okay, then we're going to go into 90-90 stretch, and then you're just going to reach out with the opposite side hand without stopping. You just get arms and change direction, and you can see I'm changing my angle that I'm reaching just so I hit different fibers. There's nothing static here because we don't want to turn anything off, we just want to activate tissue with increased range, so mobilize it really. Okay, now we're going to get the hamstring going, so you're going to reach your nose out as you straighten your leg, just to tweak in that hammy. And if you change your angle, you'll find the ones which work quite a lot and the ones that don't work a lot. Work within the range of things that feels comfortable. You can see now I'm doing a few shorter motions at my knee with a bit of speed, so you can tweak that as well. And you'll feel how changing your angle just gives you a more rounded tweak in of the hamstring. Okay. Then what we're going to do is we're going to look at trying to get the external rotators, the gluteus obturators, to fire up a little bit more to help control and stabilize the femur when it starts moving excessively. And this is kind of dynamic stabilization, neuromuscular stabilization. So if we can get into a nice stride length lunge position, and then we're just going to try and get you to rotate your hips open and close, keeping quite a lot of control of this knee. So there's going to be some motion being driven through it, but I don't want you doing this. Okay, because then your axis of rotation is here, and we want it here. So you're going to get in there, just rotate open and closed, nice and controlled so that your torso and your shoulders are moving the same distance as your hip. Okay, 15 to 20 of those in both legs. Then, this is just a piece of kitchen towel roll. I've got a newspaper rolled up inside. I'm going to put that between my heels, keep my feet facing forward, drive my heels together just to get my external rotators low but squeezing, okay? And then we're just going to squat whilst we're squeezing that. So we've got some good activation in there, and then we're just driving motion. So it gets used to being active whilst we're driving motion through the hips. Okay. 20 of those. And you get little bucks. Okay, we want a bit more glute action going, so I'm going to do posterior negative single leg squats. Okay, I'm not putting any weight in the back leg, and then you can change the angle that you reach as well. Okay, that's going to load up the hip a little bit more. Okay, and then what we're going to do is we're going to externally rotate to create a little bit more of an isometric contraction in those external rotators, which tends to drive better growth in that muscle tissue around the muscular tendinous junction, and then we're going to go into those motions. It's a little bit harder because we've taken the rotation element out, so it gives us less control. Okay? Once we've done that, there's a number of progressions that we can go into: squat matrix, lunge matrix, hop matrix, and so on, but we're going to start